Namaste everybody, this is your Dr. Sargam Soni. Thank you so much for an overwhelming response to all my educational talks. I'm back again today with another interesting topic, which is one of the common menstrual and hormonal abnormality in patients which enter our gynec chamber is the polycystic ovaries. Before I start up with anything, let me just help you by telling you what is menses or menstruation and how does a normal menstrual cycle look like. So menses is basically a physical manifestation of cyclical bleeding in a woman of reproductive age group which happens regularly over a period of month, and it is the shedding of the inner layer of the uterus or the womb of the lady. Now what does a menstrual cycle look like? What does a normal menstrual cycle look like? So a normal menstrual cycle on an average occurs at an interval of around 26 to 28 days. It stays for around 4 to 5 days, and there is a blood loss of an average of around 50 ml, 20 to 80 ml, so it averages to 50 ml. If you experience any deviation from this cycle in the terms of pattern or duration, please make sure you go and consult a gynecologist of your choice. Coming to polycystic ovaries, patients ask me often what are the common complaints with which a patient presents. So the commonest complaint with which a patient comes to us when we start thinking about the patient being a probable candidate of polycystic ovaries, for a patient of polycystic ovaries, is delayed periods. There can be a delay of anything between 2 to even 6 months of menses. Patients complain of scanty menses, which is decrease in the blood flow. Patient complain of acne, excessive hair growth or hirsutism, which is thick dark hair around the chin, the neck, the belly. So it's basically a male pattern hair growth excessive which is noticed. Many a times patients are coincidentally diagnosed when they come to us with the complaints that they have been they are too eager to conceive and unable to. So subfertility or infertility can also be one of the complaints of patients which enter a fertility clinic, and then upon investigating, coincidentally we come to know that they have polycystic ovaries. So these are the commonest complaints. And in advanced cases, the patient can land into darkening around the skin folds of the neck. The patient can land into other problems like a high blood pressure, etc. But in general, these are the common complaints with which the patients come to a gynec chamber. Now patients ask me, doctor, how does it happen? The exact cause why does polycystic ovary happen is not known, but the most important factors are faulty lifestyle and to some extent genetic as well. So there are genetic factors and there is an unhealthy lifestyle which is involved as one, the causative factors for polycystic ovaries. Now patients often ask me, doctor, what happens if we don't treat it, or it's a delayed diagnosis. So unfortunately what happens in our chamber is we have many patients who come and tell us, doctor, I have been having all these complaints, but my elderly women have told me that don't worry if you have menstrual complaints and irregular scanty periods and acne, etc., etc., because oftentimes it just goes off and it will sort out automatically after marriage. Now please do not sit on your problems unattended. I have elaborated the common complaints which can also have complaints like your hair fall, your baldness, alopecia when it goes a little extra advanced. So if you experience any of the complaints that I have mentioned, please make sure to just go and consult a gynecologist, so that in case if you have a problem, there is an early diagnosis and there is a better treatment which can be done to you, and your ovaries can be taken care of. If you leave it unattended or if it is not diagnosed or not treated, the commonest things that happen is there will be aggravation of symptoms. So there will be aggravation of acne, there will be aggravation of excessive hair growth, there will be hair fall, there will be male pattern baldness as well, because eventually it's ovarian hormone imbalance between the androgens go high, so you will start experiencing all the male pattern hair growth, male pattern baldness. When it transforms into a full-fledged endocrine dysfunction overall as a syndrome, then you can land into type 2 diabetes because of insulin resistance and hyperinsulinemia. You can land into there can be cardiovascular risks like hypertension, deranged lipids, hyperlipidemia. and there can be sleep apnea as well. So if left unattended and turns into an advanced severe stage, it can really come up with all these risks. So please, if you think you have any of such complaints, go and consult a gynecologist. Feel free to drop in a proper consultation with me or the gynecologist who you think would take care of you and your health. And please get yourself diagnosed. In case if there is polycystic ovaries, then please get yourself treated for the same. But do not neglect and do not sit on your problems unattended. It can also, as I said, one of the very common advanced thing that can happen is patient landing into again infertility and subfertility. The next thing that patient asked me is there any treatment or cure? Now let me be honest, there is no particular foolproof treatment or cure for it. Of course, when patients come to us with infertility or subfertility, we treat them with the help of medicines and we help them conceive beautifully. So that is one thing that is taken care of. Otherwise, dietary and lifestyle modifications are the ones which generally take care of majority of the part of it. So dietary changes like start taking care of the ratio of carbohydrates and fiber in your diet, incorporating more of proteins, omega-3 fatty acids and healthy fats in the form of walnuts and almonds and various seeds that you can consume. Please stay away from smoking and alcohol and any other kind of harmful addictions because they are really bad for your overall body, internal environment. Please make sure to start exercising, any form of physical activity, be it swimming, brisk walking, be it cycling, be it jump ropes. You want to go to the gym, work out, do that, do CrossFit, do TRX, do weight training. Start incorporating yoga into your daily lifestyle. It is something that calms down your body and mind. Staying de-stressed by doing meditation, prayers, you painting, hobby, anything that de-stresses you will really put everything back in place to a great extent. So all these are the basic dietary and lifestyle modifications that are very important to take care of a major part of almost 80% of your problem. So these are the basic things that I think I'm almost done by elaborating everything, which is normal menses, how does a normal menstrual pattern look like, what are the common complaints with which a patient comes to us when we start thinking about evaluating the patient for polycystic ovaries, and what if you leave it untreated, what are the risk factors, what are the risks that can happen if you don't treat it for a long amount of time, and what is the common way to take care of it. So I think I've practically covered everything that you need to know as a non-medico. And please, again, as I always say, do not self-medicate yourself. If you if you have any of the above complaints that I have mentioned in the video, please go and see a gynecologist. Please do not sit on your problems unattended for a long duration of time. Go see a gynecologist of your choice. You can drop in a consultation with me, but make sure you do not self-medicate yourself or take any over-the-counter hormonal drugs because they are absolutely unsafe. So please do not play with yourself. And meanwhile, start incorporating these beautiful little healthy lifestyle and dietary modifications for yourself, for your daily life. Start exercising, start doing yoga, and I think that should take care of you and your health. So yes, and see you super again with another interesting topic of discussion. Till then, please stay safe, stay blessed, stay healthy. Lots of love and light to each one of you, and see you soon again. Thank you. Jai Hind.